Hello, welcome to Mod Midwives, a Metro Midwifery podcast. I'm Gina Gerboth.
And I'm Nedra Hale, and we are home birth midwives serving the Denver metro area.
Welcome to episode 2 of our podcast. For today's topic, we are going to talk about 10 questions that we wish that potential clients would ask us in interviews. So as we were researching this topic, we looked at a bunch of lists from different websites. Some said, what to ask your healthcare provider, what to ask your OB, what to ask your midwife. My very favorite is 47 questions to ask your midwife.
I was just going to mention the 47 questions thing. I don't even know how we would get through 47 questions in an interview.
It seems impossible.
Yes.
It seems impossible. And so many of the questions that are on these lists are either like outdated. So, for example, what's your episiotomy rate is a question that comes up on these lists a lot. And that's just not really something that is
and there's some
practiced
out there that still have routine enemas.
Right, shaving.
Shaving.
Didn't we see shaving on one of them?
So
they're really outdated. And also, they're kind of redundant in some cases. Mm-hmm. There's a lot of information that is very easily accessible by web pages. And so we wanted to really give you a suggested list of 10 questions that get to a deeper meaning than what these kind of cursory questions often do.
Right. And it may not be a comprehensive list, but it is maybe something to add to your toolbox of questions to bring into your midwife for an interview. It's something to help round out the information that you receive.
Right. And so we're not necessarily answering these questions because the answers are going to be different from midwife to midwife. But we're going to talk about why we selected this question and kind of what information you might be able to glean from it with each of these questions.
Yes.
So the first one, of course, that we came up with was...
you want to know a little bit about the experience of the midwife that you're interviewing. So... it would be really important to ask about what they've done through their career as a birth professional, whether they spent some time as a childbirth educator or a doula, and how many of their births were in that capacity versus as a student versus as a primary provider.
Right. I think that that's a really important question because, the first 50 births really as a primary provider are still another phase of your learning experience. And so if somebody's talking about all the births they've attended and it turns out that it's only as a doula or only as a student, and not that that's not important experience.
Oh, yeah, it's definitely valuable.
But it's not the same as that responsibility as the primary provider. Mm-hmm. So I think that that's a really important question to ask. And you might find out more about other skills that they would bring to the table.
Yes.
Which is the second question. What other skills or modalities or practices do you bring with you to your midwifery practice? So this could give you a sense of what's important to this particular provider.
Mm-hmm. Yeah, such as maybe they are an herbalist or... some other kind of complementary modality. Gina is a lactation consultant and IBCLC, so that is something that is...
But it could be more pragmatic. Nedra's a biller, so that's a great skill to bring.
The incredibly boring skill of insurance billing, but it does come in handy.
Really important. So, it doesn't necessarily mean that you're looking for somebody with certain other practitioner types. But if it is something that's important to you, you might want to know that. So that would be a good question to ask. What's next on the list?
How did your personal experiences influence your philosophy and practice style?
I think that's a really good question because when a lot of people come in, they will ask you, what's your birth philosophy?
Yes.
And that is something that is pretty much shared among home birth midwives. So the birth philosophy is that birth is natural.
Right.
And it doesn't usually require a lot of intervention, and that we believe in allowing it the time to unfold and blossom. And so you're not going to get a lot of different questions if you say, what's your practice philosophy?
Right. But remember, we had an interview last week where we had a totally different understanding of the question, whether or not you are a hands-on
Right.
midwife. And
Right.
I've always answered that with my philosophy about interventions. And you were coming at it, if I remember, from the standpoint of labor support. And
Right. What does hands-on mean?
Right. And so that was so funny to realize that other people think hands-on means something different than I do.
And somebody who maybe didn't feel well supported in labor might be looking for a hands-on midwife, whatever that means to them. That might be something different to somebody else who really wants a non-interventive, hands-off birth.
Yes.
So it really can kind of go, you want to make sure that you understand what they're asking.
Maybe introduce some specificity.
Yes. and my answer to that question is always, it sort of depends on what the situation calls for. It isn't necessarily something that's so cut and dried that I walk into a birth and then I start rubbing your back and then it's just not that straightforward.
Right. And neither is the flip side of it. It's all so much depending on what's happening in that particular labor. But it's a good discussion to have.
It is. So making sure that there's really a lot of clarity around what a certain term means. But your personal experiences will have a lot to do with, what do you bring, again, what do you bring to your practice? Is it your own birth experiences? Is it how you saw people, birthing people being treated in a hospital environment? That could influence how you are practicing. And so it's going to be really different. It's not necessarily relevant what somebody's own personal birth experiences are, except that they can really influence somebody's practice style. Right. So it's a good getting to know you question.
Yes.
This next one comes from, it was kind of a pushback on some of the questions that we were seeing on the lists. So one of the questions that we saw on these kind of other lists on other websites was, I plan to refuse X. How do you feel about that?
Right.
And we thought that asking a question like this, when might you recommend X?
Oh, yes.
And under what circumstances? That might give you a little more clarity as to what that midwife's practice approach would be. So, for example, if you want to minimize vaginal exams, if you just kind of say, I'm going to decline all vaginal exams, you probably won't get a lot of input from that midwife.
Right. It's kind of a closed
question. It's a closed-ended question, exactly. Whereas if you say, tell me when you might recommend a vaginal exam, somebody says, I do them every hour in labor, which, by the way, I don't actually think most midwives would say that.
Unusual.
But if they say that and you want to avoid them, then that's really gives you a lot of information.
Right.
And other things besides a vaginal examination would maybe be an ultrasound or a consult with a physician or even a transfer of care. At what point would you recommend a transfer of care? Good. What's next?
Let's see. How do you stay up to date on new information? How do you keep your practice updated and skills, emergency skills, that kind of thing?
Yeah, that's a really good question because information does evolve over time.
Oh, yes.
And I would encourage you to find a provider that does value that as a general rule.
Yeah, I mean, so many things change through the years, and it is really important to be able to flow with the new information and make sure you're providing the best care that is the most up to date.
Yeah, and while that sounds maybe like a dig at longer term practicing midwives, it's really not, because I know lots of midwives who've been practicing for decades and are really have a high value placed on staying up to date. So
absolutely,
it really doesn't have anything to do with how long somebody's been practicing, but rather how have they...
It could even apply to a very new midwife that was trained a certain way
Yeah.
in a practice, that new midwife also needs to be open to adapting to the new information.
Absolutely. And open, I guess, is a good word, but open to questioning some of
Yes.
what they were taught as a
Question
student.
some of your training.
Yes.
Of course.
That's
yeah.
really important. Which kind of brings us to the next question. We talked about staying up to date, when would you consider a transfer of care? The next one is talking about under what parameters would continuing with my planned home birth be considered okay, and when would we be looking at maybe transferring care or needing to change the plan? And the reason that we have this question in here is because of a question that we saw, which is, how long can I go past my due date?
Right.
It was a very specific question.
Yes.
And that's a problematic way to approach it because it's not that straightforward most of the time.
There's all sorts of gray area in there about anything could happen at any point in pregnancy. So it's much more important to know when we would be stepping outside the quote unquote low risk category.
Right. Which is the bottom line, because home birth is really only appropriate for low risk birthing people. But, just because the state rule, for example, in Colorado says that you can go to 42 weeks, that doesn't necessarily mean that's going to be appropriate in your circumstance when you're 41 weeks, 41 and a half weeks, or even less. It really does depend on what's going on. So you might get an answer like, as long as everything's okay with the health of the baby, as long as you're doing well, as long as there's some kind of caveat.
Right.
That's really what's important in that question, because it's not going to be, it's just not straightforward. And at 10 weeks or 11 weeks or whenever you're interviewing us, we don't know. We just don't have that information.
Right.
So a discussion about the nuanced kind of circumstances is really important.
How do we go about making those kinds of decisions, and how the discussion would happen and all of that?
Right. And remembering that, of course, you've invested a lot of time and energy into your home birth, and we all want that.
Absolutely.
But we always have to be ready to change the plan if it's necessary. So, this next question, how would you handle common complications? And then you might give a specific example. And this would be for somebody who had something come up in a previous labor.
That's good.
Maybe heard about a complication from their sister, those kind of things. If you want to know about a specific issue.
Such as when we hear all the time, my family member or my friend had to have a cesarean because the cord was wrapped around the neck 3 times. These are really common things that come up. What else? Jaundice.
Right. Jaundice is a good one because you can gauge a pretty good amount of information from that. So, if a midwife says, well, jaundice is never a problem.
Right.
Or I always check the bilirubin at the day 3 visit. Anytime you hear an always or a never, that should prick your ears up a little bit and kind of get to a little bit deeper information.
Yes.
Because many times, for jaundice is a good example, many times it's normal within a certain range. But once you get outside of that range, then it can actually be really dangerous. And so you want to make sure that you have a provider that's paying attention.
Some other things in this category might be whether your midwife would suture if you tore, or how often she needs to suture.
Yeah, that's a great question.
Or,
And whether she would use, this comes up quite a bit, would she use lidocaine in the event that she needed to suture? So sometimes people have asked us earlier in the interview, like, do you offer any pain medications? And we say, well, no, we don't really have pharmacological pain meds available to us in the home birth setting. But they can sometimes misinterpret that as not offering lidocaine for suturing. So making sure that you're getting the standard of care for something like suturing is really important.
Yes.
And apparently it's not a foregone conclusion, so it's a good question to ask. So a lot of times people will ask us, what do you bring in case of an emergency? They want to know what's in our bag. But that is probably less important than what we do in the case of an emergency. So we framed this next question as, tell me about an emergency you've experienced and how did you handle it? So
good.
I think that has a different, it's a different angle of the emergency question.
Yeah, I think that's really good. And I think it is also important to know that your midwife does carry emergency supplies and equipment.
Anti-hemorrhagic medications, oxygen and resuscitation equipment.
Right.
Yes.
But how would you handle certain situations, or how did you handle a certain situation? I think that's really good.
I think you can get a lot of information, depending on kind of what you're interested in learning about. You might ask that in a way like, tell me about a time when you transported by ambulance. If you wanted to know more about the interprofessional collaboration, the skills and interprofessional collaboration that your midwife is bringing to the table, or if you want to know about the receptivity of the EMS and the hospitals around you, that will give you some information about how well is the transition likely to be if you did have to have an emergency transport situation.
Yes, very important.
Oh, yeah, I love this next question. What is something you've changed about your practice?
Yeah, that's a really good one. And when you brought that up, I had to try to think of all the things. There's so many things because we change as time goes by. We learn things, new information comes out, like what we were talking about earlier. And lots of things, which I think is good. I think that's how it should be.
I had to think about the things that I've changed about my practice, and I know that there's just so much, the way that I share information, how I engage in that process of shared decision making, and how that's different from informed consent or informed choice.
Yes.
I think that's kind of the big thing for me is, how do I gather information, present information, and help my clients navigate the best decision for them was sort of kind of what I came up with when I was thinking about that.
And you're just continuously trying to improve. It's just...
Right, and that's just such an important thing for any practitioner.
Yeah.
But it could be skills. It could be, any number of things.
Yes.
So, yeah. And guidelines change. The neonatal resuscitation protocols have changed
many times over the years.
Yeah.
And then we adapt to those changes. And, midwives have known for a long time that delayed cord clamping is really great, but now the evidence is supporting that. And
right.
So.
Right, which I think is really important when we're talking about, I think that sometimes people want to ask about, how does the evidence inform your practice? And that is important.
Yes.
That kind of goes back to that staying up to date. But also, sometimes we do things that aren't evidence-based. For example, we were doing delayed cord clamping long before there was a very robust body of evidence to support it.
Right.
I think water birth is probably one of those things that there's some evidence to support it, not a lot of evidence to support it. So, sometimes we do things because we experientially know that they work and they're something that our clients value.
Yes.
But they're not necessarily completely and totally backed by research.
Right.
So,
right. And maybe it'll catch up.
And it probably will. I really do believe that. And as people start using their voice as consumers, I think that they will be able to affect more change on a systematic level. So then the last one actually came from an interview that we had.
Yes, it was
last
so good.
Week. It was a great question.
It's what is at the heart of midwifery for you? Yeah, I thought that was so good.
It's a great question because it's different from your birth philosophy.
Yeah.
So we should share what we answered.
Oh man, it was so. First of all, I just want to share with you, it was so great because we hadn't slept the night before, and so you have that kind of. I don't know if everyone experiences this, but I feel like I feel things a little differently and maybe more philosophically in those moments of being super exhausted.
Yes. Yes.
So I was just like, wow, this is so great. So my first instinct was to say that it is all about the autonomy, right? That I want birthing people to be able to make really good choices based on the shared decision making and informed choice and all of that, and that's totally true. But also, I'm so much about the baby's experience. The experience is so important in the bonding. There's so much.
You're right. It's defining.
Yeah.
It's not just a matter of setting the stage, which it does. It absolutely sets the stage for breastfeeding success, or that kind of keeping the skin-to-skin contact, keeps the temperature regulated and the blood sugar regulated. It has all these physiologic things that happen, but it also really sets the stage for, I think, how this family is going to start.
Yes, it's everything.
It is.
How we start is just everything.
Right. And speaking of evidence catching up, the more that we're learning about epigenetics, the more that we're understanding that sometimes these things have switches that get switched on or off. And by supporting the natural processes, we are not interfering with the ability of those switches to be switched on or off.
Yeah.
It's kind of deep, like you said.
Yeah, it's really
the
deep.
Moments of sleep deprivation do bring that to you, but I think it's really, it's just a critical consideration for how you want to help a person get started.
Yes.
So
absolutely.
So, those are kind of our 10 questions. Every midwife is going to answer them differently, and you want them to answer them differently.
Yes,
you don't want to have cookie cutter midwives,
definitely.
but you want to make sure that you're getting to a, the depth of what the question is asking. How up to date, how not only how up to date, but how much does this person value new information, and combining that with what they've known for years, what's been effective for them, and all of those kind of things. And I should also say, I feel like the answers are going to be weighted differently for different clients. So that's going to be really important.
It matters a lot what your values are that you're coming in to the interview with, and you should definitely ask the things that are going to lead you to the answers that are important to you.
Right. Which probably, these questions are probably a little bit leading because our values are reflected in that. The values that we embrace as midwives and as practitioners. So, probably other midwives would come up with 10 other questions to
probably
ask.
So.
But the big thing is, take advantage of the information that is out there already. Don't replicate really logistical kind of information. Use the time that you have in this usually hour-long interview to really dig a little deeper, is what I think we're trying to say. So we will have a blog post with the questions and the, kind of just the background information as well.
Good.
So check out the blog at www.metromidwifery.com/blog. You can also find our podcast on their own podcast page. Again, metromidwifery.com/podcast. We also are on Twitter and Facebook and Instagram and all the things. So we hope that these questions will get your wheels turning a little bit.
Yep.
And give you a little bit of insight. Next week, we plan to have a topic of interest to midwifery students. So you want to be a midwife.
Yes.
So again, our podcast and our blog is meant to provide insight for different, sometimes it'll be client-centered and sometimes it'll be student-centered or midwife-centered.
Yes.
So next week, look for that. So thanks so much for joining us.
Thank you for listening.
Yeah, we'll see you next week.